There really hasn't been much luck in the Bieber household with their health recently, since Hailey Bieber went to hospital with a mini stroke, and Justin Bieber, you may have heard, has now been diagnosed with Ramsay Hunt Syndrome, and half of his face is paralysed. I'm a doctor working in the UK with a background in ear, nose and throat surgery, as well as family medicine and accident and emergency. So in this video, I'm going to go through what Ramsay Hunt syndrome is caused by, the signs that it's there, how it's diagnosed, as well as treated, and any long-term issues that might occur as a result of it. So first of all, Ramsay Hunt syndrome is caused by the same virus that causes chickenpox. After the person gets the chickenpox virus when they're young, and once they clear the infection, it remains dormant in the nerve root, and then later on in life it can become reactivated. It's called the herpes zoster virus. It can affect many different nerves. Sometimes you might see a band on the chest or the back, most commonly. But when shingles affects the facial nerve, that's called Ramsay Hunt syndrome, which is what Justin Bieber has. Now, that reactivation of the virus leads to a few different signs that Bieber really has shown us quite well in this video, so thank you for that. And you get basically a paralysis on the side of the face that's affected. Sometimes when people are told to smile, people think that it's the area that's smiling is the one with the problem, because the other side looks quite normal, but actually it's the one that looks normal that's affected. And we know that because there are some other signs there as well, such as around the ear, there usually is a rash, which is characteristic of that virus, as well as in the mouth. Patients with the condition also will struggle to close their eyelid, since the facial nerve helps to do that action, and also helps with taste, so some may have that affected as well.
As you can see, this eye is not blinking. I can't smile on this side of my face. This nostril will not move.
Diagnosis can be tough because there is a very similar condition, which is in fact even more common than Ramsay Hunt, called, you may know it, Bell's palsy. It's a great imitator of stroke, and many people think that you have a stroke when you have Bell's palsy, but there is a really easy way to show that it's not a stroke. You may not know this. If you can lift the eyebrow on the affected side, then that means that it is likely a stroke. If you can't, then that's quite reassuring. So the reason why is because the nerve that controls the eyebrow actually originates from the other side of the brain to the side that's affected in a stroke, and so can still go through and join up with the nerve that's affected to allow the eyebrow raising. But because when you have Bell's palsy or Ramsay Hunt, it affects the nerve further down, when those two nerves have already joined, then it doesn't allow you to raise the eyebrow still. So that's a really important sign if you see anyone with facial paralysis. So just to recap that, if they can raise the eyebrow and the rest of their face is paralyzed, that's more likely to be a stroke in that case. So seek immediate referral to a hospital. Now, it is important still to catch Ramsay Hunt syndrome early, because treatment would need to be initiated within the first 72 hours. That would include antiviral medication, acyclovir, usually, as well as a steroid at high dose and some painkillers. If those are initiated within the first 72 hours, then there is a 70% chance of a full recovery. But if not, then there's only a 50% chance of a full recovery. So that is really important to get those in early. Other ways to help is just some more conservative measures. So since the eyelid doesn't close very well, you would need to tape the lid shut. and if the eye continues to have problems even in the first 4 weeks, then it's worth seeing an ophthalmologist to make sure that you're not developing any long-term complications. So what could be the complications of Ramsay Hunt syndrome? Well, you could be left with a residual weakness of the facial muscles, which are controlled by the facial nerve, or weakness in eye closing, and sometimes it can lead to the eye actually being damaged in itself as well, and a loss of vision. So do not hesitate to seek consult from an ophthalmologist if you feel that you are being affected in that way. And also with treatment, we would expect symptoms to resolve within 4 to 6 weeks. If they do linger on after that, see your clinician to make sure that they have the right diagnosis. Now, they may have to then exclude other causes of facial weakness and do things like an MRI scan at that point and some blood tests to ensure that all is well. We do wish Justin Bieber a speedy recovery. It's likely that being stressed is what's caused this reactivation of the virus, so this could be a sign that he needs to slow down, and I think he's taken that on board because he's cancelled some of his tours, which obviously is frustrating for his fans, but I'm glad he is taking the time to heal, so he's 100% ready to perform for his next set of fans. I hope you found this video useful. If you have, please drop a comment down below and give me a like. It does help a lot. And if you have enjoyed this one, you may like this video on Billie Eilish and her Tourette syndrome, how she controls her tics. Quite fascinating. And I will see you in the next video. Stay healthy, stay happy. Bye-bye.